Hello and welcome to the Voice of the Patient podcast. We are the podcast working to change lives, that is, improve the quality of life through not only hearing, but truly listening to the voice of the patient.
Hello, everyone, and thank you for tuning in again to the Voice of the Patient podcast. This is part 2 of our Mental Health Matters series with Sean Hagey. This is the second episode, so if you haven't listened to the first one, then please stop and go back to listen to that one. We continue our conversation about Sean's experience, and we specifically dive into what has helped, what some of the coping mechanisms have been for him, as well as what treatment has looked like for him over the course of his life. Before we jump back into that conversation, I just want to add a couple of reminders. One, that this involves some dark topics that may not be appropriate for kids listening. And also a reminder that neither Dave nor I are practicing providers of mental health care. We and Sean are clear that nothing we discuss in this episode or any episode in this series should be considered in any way as medical advice. We strongly encourage anyone listening to contact your medical doctor for a referral to a mental health provider if you are struggling with mental health issues. Also, if you're listening to this and are considering ending your life, please don't. You can call 911 or the National Suicide Prevention Lifeline at 1-800-273-TALK. That's 1-800-273-8255. Thank you again for listening and enjoy the episode. As far as having the physical elements of it too, I imagine that had a profound impact on your career as far as what you were able to do and not do. Could you talk about how you were able to change coping mechanisms over the years, say going from your high school years and moving forward to today?
Yeah, it's one of those things, and funny that you should bring that up, because it kind of ties back into what we were talking about earlier, actors and depression. Folks with mental illness are really good at being actors. I think to the point where I can maybe even fool myself. I don't know. But, as I've come out with depression, people have said, like, I would have never guessed. How would I have ever known? You don't seem sad. It's learned. Some of it's not consciously learned. I just learned to talk and interact differently, so people aren't like, what's wrong with you? Why are you sad? But part of it's also a conscious decision to put on a different face, not necessarily to live a fake life, but to choose to portray just a different side of you, largely fearing that people don't want to see that other side of you. So I'll show them the other part, because I am a goofball and I am laid back and I do like to have a lot of fun. I just also have this really dark side of me that I'd rather not let people show. So that plays into it as well. So coping mechanisms, get married and start to get involved with that. You kind of dive yourself into certain things, whether it's a career or the more you can keep busy with something else, you don't have to focus on internal strife. I think that's what a lot of people do that don't have mental illnesses. Hide from their problems, cover them up with certain things, run from them. We're just maybe a little bit more experienced than those of us with mental illnesses on dealing with it. But it brings up the next point for coping mechanisms is you talked about overdoses. Here's the scary thing that nobody wants to talk about, even in the mental health community, is substance abuse happens. And why does it happen? Because people are looking for something to stop the pain. And you know what? Alcohol works. It does. It works real good. I can have a couple of drinks and not have suicidal thoughts. No shit. That's just how it is. I have a self limit to 2 drinks. I don't ever go over that. I'm kind of afraid of what would happen. There's some substance abuse in my family. I'm not really interested in going down that road. But when you look at substance abuse and mental health, there's kind of the chicken or the egg, what led to what. I'm of the impression, from personal experience and talking to lots of others in the mental health community, that you look for something to cover it up. If you're not going to get professional help, you have to, or you're dead. So you're gonna commit suicide, or you're going to find some way to cover it up. Thankfully, I've never gone down the road of the heavier drugs, but I can only imagine that, especially uppers like cocaine and meth and all those things provide. It's a terrible solution, but it at least provides somewhat of a temporary solution from the excruciating pain. I can relate to those people. I think that's one of the things that we're overlooking in this country right now as well.
Like self-medication. So you talked a little bit about some of the self-medication, some of the attempted help that you were put through as a teenager. When was the next time that you actually kind of saw an actual provider? You talk about sort of that time period and that situation.
Yeah, I was let's see, I would have been 30 years old, and it was my second major depressive episode. The first one was,
so just kind of being clear, like, so from about 15-year time period.
Yeah,
it was not great, but like not so deep that it was kind of at the same level.
Yeah, I was still functional to a certain degree. The first, like, that I can really put my finger on, first major depressive episode was after my uncle had killed himself. It was 8 years ago, and I couldn't shake it. Like, none of the stuff that normally worked. I play several musical instruments. Music is a huge escape for me, but I couldn't shake it. I couldn't shake it. Nothing worked. I think my work suffered overall. I was fatigued all the time. I slept all the time. Looking back, it's pretty obvious, but I was somewhat functional. I was able to go through it, but crap really hit the fan about 4 years ago, when my family life really, really fell apart, and I had started to make active plans. So I decided to actually talk with the doctor about it for the first time in 14 years. And saw our little family provider, and he referred me to somebody, and very suspiciously, but honestly had no other options. I went, and I thankfully I had a really good experience that time. I sat down with a counselor who didn't sit in judgment at all, and was somebody I could say anything and everything to in complete confidence. And that started me, at least on the road to actually addressing it and dealing with it.
So after talking to your doctor about that, and from that point on, what were some of the strategies?
Yeah, that's when I first started, because I'd never taken medication either. So that's probably a whole nother series by itself, right, David? Medication, but I started taking medication.
Any strong opinions either way on medication?
No, it's a long story all by itself. You were talking about a mini series, and I don't know if we have that much time.
We've got plenty of time.
But that's when I started on medication and counseling as well. So part of it was seeing the therapist at first at least twice a week, because it was pretty severe depression, and trying different medications over the next 4 years now, trying to find a dosage that gives some relief of symptoms, and medications that I can also tolerate as well. The unfortunate thing with a lot of psychiatric medications in general, but especially psychiatric ones, is there's a lot of side effects involved. You start screwing with serotonin and crap in your brain, weird things happen to your body and brain for that matter. So counseling has been a big part of the last 4 years, regularly meeting with somebody off and on. And medication has also been, I hate it with all my being. I hate how it makes me feel, but I guess if it keeps me alive at the end of the day, then it's probably worth it.
As far as medication's concerned, as far as your conversations with your doctor about those, is that something that those who are working with medications should think about discussing that with their doctor?
Yeah, absolutely. Some doctors are really good about saying, okay, here's what to expect. Here's what the plan is. Here's where we're going to go. And you're very informed. And then other doctors, not so much. I remember going back, being like, wow, I feel like I'm going to throw up every time I have to eat. Going back to the doctor and like, oh yeah, nausea is kind of common with these. Just like, wow, that would have been really, really good to know when I started taking these. That kind of stuff.
That really fast voice with the nausea, depression, diarrhea.
Right.
Grow a third eye and a tail.
Yeah.
All that stuff.
Well, and then part of it is you think, it's not going to happen to me. Well, in my case, it absolutely has. So I'm not gonna crap on people that take medication because it's saved a lot of lives. It has also made some people really, really miserable instead of providing a lot of help too. It's fortunately we're living in a day and age where they're not performing lobotomies anymore or locking us up in insane asylums, because that's where I'd be if I was born anytime before this. So at times it seems like our mental health care system is incredibly barbaric, but it was a hell of a lot worse. So, and I have a feeling that 30 years from now, we'll look back and we'll be like, I don't know how the heck those people survived. So, from this day and age, but I'm hopeful. But yeah, medication is one of those things where I've been on in 4 years. I've tried at least 13 different medications. Most of them just side effects that just didn't make it possible. And that's true with the first generation psychiatric meds. Yeah, it helped some people, but it also produced a lot of side effects. And so you would just take enough where you had that right return on investment. Like how much crap can you tolerate versus symptom relief? When we're going to, it wasn't expected that you weren't going to have side effects. It was that, okay, how much can you take and handle? And so that's part of what my journey has been with it as well. I have my brain's pretty sensitive to those kinds of changes. So it's been a really rough go. And, some things have worked a little bit better than others, but to date, we haven't found the magic cocktail.
Mm. You also mentioned that you love the counseling aspect of it. Could you talk a little bit about counseling? Maybe some of the things that you're in therapy that have led to other coping mechanisms, other things that have helped you up to today.
Yeah, like cognitive behavioral therapy has been really helpful for me in especially dealing with like the anxiety piece of the equation. Not as helpful in the depressive side, but learning how to challenge some of those thoughts, learning what you can do mentally and physically to start to have some control over the situation instead of feeling helpless and hopeless. That first and foremost is really powerful, at least like I said, from an anxiety part. From a depression part, one of the things that's helped me the most is one of the counselors that I've seen the most and lately deals more on the existential side of things, which might sound kind of weird at first, but it's basically finding purpose of like reasons. That's more powerful to me. I've kind of come to a place where I've accepted that this is kind of what I'm going to be. Like, as far as relief has come, once you've tried this many medications and therapies, you have somewhat, to a certain point, treatment resisted, depression. So, but working on that part has been really helpful for me, having kids and being able to talk about purpose beyond myself, having a purpose to live for my girls, take care of my girls, to look after them, to be in a profession that is really rewarding, where I get to help people. And honestly, that's part of what Get PT First is about. From a counseling standpoint, is find something bigger than yourself that you can give to. And the amazing thing is, when you feel really empty inside, that doing something for someone else in service of others is one of the most rewarding things. And you find that tank starts to fill up a little bit. It's very paradoxical, but it's very true, especially for me. So that kind of brings, for the Get PT First thing and some of those other things, being able to take part and give back in a way that allows me to be creative and that artist brain that I have, that creative brain that I have, and in a way that I can give back to my profession, to the community, to my neighborhood, to my family, has been the biggest difference for me. If it wasn't for that, I honestly wouldn't be here. I really wouldn't. I would have given up a long time ago. When I'm confronted with those passive and start to go down the road of those active thoughts, that's how I rein it back in. It's incredibly effective for me.
That's really powerful. It's really amazing to hear that. And I can say, I know for sure that many people, to the point that I can't even put a number on it, have really appreciated the work that you've done. And I love that it actually touches on a couple different benefits from counseling. And that's one, like you said, is the purpose. And the second is the self-efficacy, to find ways yourself to help cope. And I can see that in a lot of what you've done is really help yourself out of a spot in that moment, even though you continue to seek treatment. It's not that you're going it alone, but it's in those small moments of the day when you're not in a session of knowing what to do with that. So that's really powerful. And I can see how that has had a tremendous effect. And I also want to go back to something that you'd mentioned a couple times is the anxiety and the depression. So for some listening, they might not know the exact differences there of what that might mean. Could you talk a little bit about how anxiety and depression might be different yet similar, how they go together, but how they are different?
Yeah, it's one of those things they don't have to go hand in hand. You can have one or the other and not both. But there are quite a few people who do have both. The anxiety part looks more like constant worrying. We talk about those cognitive distortions. They're more of like on the hyper side of things, like just going that rabbit trail down your mind of what if scenarios and oh my, what about this? What about this? Is this what they really meant? How does that go? Those kinds of anxiety types of thoughts, that nervous energy component. The depression side, there's rumination, which sounds like it could be really similar, but rumination I like to call is the slow loop around the toilet bowl on the way down the drain. It's that thought that you just cannot get out of your mind, and you keep going around it, and you just beat yourself up farther and farther until you just go all the way down the drain. So it's anxiety is almost that tornado going up. and depression can be that tornado going down. Now that's a really simplified way of saying it, how it looks like in my life. I know that it's going to be different for some other people and expressed different ways, but at least for my personal, kind of life, that's what it looks like for me.
Right. And I remember that's something that we had talked about in my training in psychology and you described it perfectly of anxiety being elevated. It's almost things are going faster and there's a heightened state and with depression, it's really can be the opposite of things slow down to come to a stall. But I love that how you described the difference with rumination. And a big part of that too is rumination is often looking backward, looking to something that had happened and really trying to analyze it down into this pit of the worst possible interpretation of it. And usually anxiety being something that's forward thinking about the future of what if that happens? What if this ends up being the outcome and it's like the worst possible outcome? But with rumination, something really diving deep into the past and sort of a beating yourself up about it. And that can be something that's very related to depression, the rumination aspect of it, and the anxiety being a forward thinking process as well, but really overanalyzing of the possible directions that could happen. And as you said, the overlap is quite common. It doesn't happen with everyone, but those with anxiety and depression, it can go hand in hand. And that's another chicken and the egg situation of what comes first. Because if you end up being overly anxious to the point of not even doing anything because if you're afraid of what could happen, then you could end up getting depressed because of the effect that has on your life. And that's a tough thing of where to jump in and what to work on first. So that's really we really thank you for sharing that. And could you talk about how in the last say year or so, how have struggles impacted your personal life? How have things been in the most recent year? And what are some things that you've been doing specifically in order to cope?
2016 was a really weird year for me from a professional standpoint. It was it's the best year of my life. I got honors. I was appointed to a position with the home health section, the chair of the PR committee. I finally decided to take the Mensa test, and I'm a Mensan. I've got an IQ in the 140s. I spoke. Yeah,
not to brag.
Yeah. Well, it's a side joke. My wife, when we found that out, she was like, "How are you not super arrogant about that?" I said, "Because my brain tells me to kill myself." It's hard to be like I know everything. I'm smarter than you, and I also hate myself.
Yay, depression jokes.
Yeah.
Oh, man.
Yeah. Oh, I've got a lot. It'd probably make your listeners very uncomfortable, but I've got a lot.
Yes. That's coming up on episode 4 of the miniseries, depression jokes.
Yep. Yep. It's a really healthy outlet for me. It's not for everyone. Yeah. And I wouldn't say it mostly, but, oh, that's hilarious. Where were we? What were we even talking about? Sorry, I went down.
Sean Hagey is the smartest man on the earth, is I think where you left.
Oh no, my year. Yeah, I spoke at CSM. I was a speaker. I was the first PTA speaker that the section's ever had at the conference. I spoke at the student conclave. I spoke at a state chapter event. I also, in the middle of that, had a major depressive episode where I missed 2 months of work. And for about a month of it, I almost never got out of bed. I joined, they call it an intensive outpatient program, where you go for long chunks of the day for group therapy, because I had an active plan and I almost went through with it. In the middle of all that, it doesn't make any sense, does it? And that's what mental illness is. It's not logical. Logic says, wow, you got a lot of stuff going for you, Sean. This is great. My brain says, it's never going to get any better than this. It's only going to get worse. So I checked into this intensive outpatient program, and in the middle of that, and being at the absolute bottom, incredibly suicidal, I started to really, really dig deep and get some of the help and address some of the issues that I had never really addressed before. Sorry, what were you saying, Dave?
No, I just I think it's fascinating. I think that the perception is often that suicide happens as an impulsive type thing, but what you're describing is a process almost where there's checkpoints along the way where you have decisions to make, and it almost, I mean, and correct me if I'm wrong, but what I'm hearing you describe is having to say yes at every particular checkpoint in order to actively go through with the plan. But if you say no, that's thankfully you ended up in the intensive outpatient program. But is that, am I hearing that right? Is that kind of common? Is it different for everybody? It just doesn't seem like an impulsive type decision that you're describing.
No, certainly every situation is different. And some people make a decision very impulsively, but there's a lot of us. And when I see people that have decided to end their life, where you look back, and I'd frame it this way, Dave. It's kind of hard, but I'd frame it this way. Remember the people jumping to their death from the World Trade Center? That's what a lot of depressives are like at the end. It's not that we're afraid of dying. It's that we cannot fathom the alternative of continuing to live. That slow death, dying from the inside daily. Eventually you just say, I'm not necessarily endorsing this, but I've got to have a way out, and I'm going to take it. So that's certainly a part as well, where I think a lot of people don't realize that it goes into it. And so they might look back and they say, I never got any warning signs. Well, maybe you did. I know when I'm going down the rabbit hole, I start to tie up loose ends, if you will. They might be hard to see in the moment, but looking back, you can see them. But I would really caution people, you can beat yourself up over that kind of stuff, but you're not going to save that person. Like me, to that point, there was nothing you could have said to me to convince me. It was going to either come from me or not. Yeah. So that's the tricky part as well, is survivors. I watched my aunt and cousins deal with my uncle's death and the horrific ripples that caused. And that's part of a reason for me to continue. I'm not going to do that to my girls. I'm not going to do that to my family. I saw what that leads to.
I had a buddy in high school who obviously was dealing with the same thing. I don't know, but it was certainly severe depression. He ended up going through with it. Going to a suicide funeral is a completely different thing, because it's kind of shocking to everybody around, but in the end, as you're reflecting on it, doesn't seem necessarily shocking to the person that actually went through with it. It's something that kind of sticks, and and I think this is the first time that I'm actually getting any kind of clarity, or having that kind of insight on it. So already I think that the purpose of this talk is being fulfilled.
Yeah, it's something that I imagine that we all have seen. I can looking back, I know several classmates who've committed suicide, even going back to even in high school, and it happens, and it comes as such a shock, and you just wonder what, for those who don't, what it looked like not going through with it, and say, even though you have this plan to not go through with it and to seek an alternative. And could you talk about, Sean, I guess, what were some of the things that got you off that path and that got you into seeking something else?
looking back, it's honestly, it's pretty foggy in the moment. Like I talked about the filter. I'm just thankful that I had enough judgment left to make a healthy choice that wasn't clouded by those thoughts, those hopeless, worthless thoughts. I like to think that the thing that saved me this summer was my family, and having some of those talks with the counselor about purpose. But looking back to my teenage years, I could have very easily pulled the trigger and the story wouldn't have lived out. I wouldn't be here right now, and people would look back and they'd say, you seem like a fun, lighthearted kid. Nobody ever suspected it. So it's, looking back, some things are very clear, but looking back, some things are very murky too. Sorry, that doesn't answer the question.
No, it's great. It's great information, and as you said, that fog of it, I think, is something that's worth thinking about. Is that, and that, as you said before, that the thing with mental illness is that it's illogical, and so when that period of, I guess you could say, maximum illogic is happening, right? That you're starting to think this way that just doesn't make sense. I can understand how there'd be a fog there, because if it's not really computing, and then
I used to yell at my counselor about that. Cognitive behavioral therapy works really good talking about anxiety when you're cycling up. It really helps me to pull it back down and recenter myself. But when the depression is going down that spiral down the drain, no effort in the world can push that back up. And I would say, so when my brain is saying that, I'm just supposed to say, but you're awesome and you're worth it and people love you and all kinds of, goober stuff. It's like throwing a pebble against a brick wall and waiting for the brick wall to come down. It seems like the biggest, like, you're going to use the logic of your brain to defeat this mental illness that is completely illogical. That's never going to happen. That's like the insanity of just thinking like, that's great. I've got this great logical brain. It obviously is smart and it works. But you know what works better? Depression. It wins. Like when you have, I've joked with people about like having some type of physical ailment. At least you have control of your mind during that physical ailment, and you can kind of talk yourself through things. But when crap is hitting the fan and you're on the downward spiral, to like have enough mental capacity to steady yourself and right the ship is damn near impossible.
We have a ton more to talk about, and we've really kind of only just gotten through Sean's story here, and so in order to kind of keep these a little bit more digestible as far as bites and things to reflect on, we'll wrap this episode up here. So again, thank you to Sean, and we'll be back in just a little bit with the next episode here in the mini series on mental health. Thanks for listening to The Voice of the Patient.
If you enjoyed this episode, go to thevoiceofthepatient.org, where you can find other helpful podcasts and blog posts that will show you how to improve healthcare through not only hearing, but truly listening to the voice of the patient. Thanks for listening. This podcast is brought to you in partnership with the Senior Rehab Project at seniorrehabproject.com.